The UK has seen a rise in cases of a respiratory virus called HMPV, which stands for human metapneumovirus. This virus is similar to other respiratory viruses like RSV and the flu, and it primarily affects the respiratory system. HMPV stands for human metapneumovirus. It was first discovered in 2001 and has since been recognized as a significant cause of respiratory infections, especially in young children and the elderly. It's important not to panic. While the increase in cases is concerning, most people who contract HMPV experience mild to moderate symptoms, similar to a common cold. The NHS says cases are high but are still within expected levels. They are closely monitoring the situation and are prepared to handle any potential surge in hospitalizations. However, the NHS is advising people to stay home if they have symptoms of HMPV. Symptoms can include coughing, fever, nasal congestion, and shortness of breath. This will help stop the virus from spreading. Simple measures like washing hands frequently, wearing masks, and avoiding close contact with others can make a big difference. HMPV is especially common in young children. Parents should be vigilant and seek medical advice if their child shows severe symptoms or has difficulty breathing. Data shows that in the last week of December, over 7% of children under 5 who visited the GP with respiratory issues tested positive for HMPV. This highlights the importance of monitoring and early detection. The rise in cases is a good reminder to be careful. We should all be mindful of our health and take steps to protect ourselves and others. We should all try to stay healthy and prevent the spread of viruses. Regular exercise, a balanced diet, and staying up to date with vaccinations can help boost our immune system and keep us safe. HMPV was first discovered in 2001. Scientists in the Netherlands found the virus. HMPV is a common respiratory virus. This means it affects the nose, throat, and lungs. HMPV is part of the same family as other viruses. These include RSV and parainfluenza viruses. These viruses can make us feel unwell. HMPV is a seasonal virus. Like the flu, it is more common in the winter months. HMPV often causes symptoms similar to a cold. These symptoms include a cough, fever, sore throat, runny nose, and body aches. Some people also get a headache. In a small percentage of cases, HMPV can be more serious. This is more likely in people who are already vulnerable. These serious symptoms include wheezing, difficulty breathing, and chest pain. If you have any concerns about your symptoms, it is always best to seek medical advice. Your GP can help you understand your symptoms and get the right treatment. HMPV transmission and prevention. In this section, we will explore how the human metapneumovirus, or HMPV, is transmitted and the steps you can take to prevent its spread. HMPV spreads easily from person to person, especially in crowded places where close contact is common. It spreads through respiratory droplets that are expelled when an infected person talks, coughs, or sneezes. These droplets are released into the air and can be inhaled by people nearby, leading to new infections. You can also get infected by touching a surface that has the virus on it, such as doorknobs, tables, or other commonly touched objects, and then touching your face, especially your eyes, nose, or mouth. The incubation period for HMPV, which is the time between exposure to the virus and the onset of symptoms, is typically 3 to 6 days. This means that you can spread the virus for several days before you even know you are sick, making it challenging to control the spread. There are several things you can do to prevent the spread of HMPV and protect yourself and others. These include washing your hands frequently with soap and water for at least 20 seconds, covering your mouth and nose with a tissue or your elbow when you cough or sneeze to prevent the spread of droplets, and staying home when you are sick to avoid infecting others. By following these simple yet effective measures, you can help reduce the transmission of HMPV and keep your community healthy. Treatment and outlook. There is no specific treatment for HMPV, also known as human metapneumovirus. This virus primarily affects the respiratory system, causing symptoms similar to those of the common cold or flu. Most people recover on their own within a few days to a week. The body's immune system is usually able to fight off the infection without the need for medical intervention. Treatment focuses on relieving the symptoms rather than targeting the virus itself. This means managing fever, cough, and congestion to make the patient more comfortable. This includes getting plenty of rest and drinking fluids to stay hydrated. Warm liquids like tea or broth can also help soothe a sore throat. You can also take over-the-counter medications to reduce fever and pain. These medications can help alleviate discomfort and make it easier to rest. In severe cases, people may need to be hospitalized. This is particularly true for individuals with weakened immune systems, the elderly or very young children. Hospitalization allows doctors to monitor their breathing and provide oxygen if needed. In some cases, additional treatments like intravenous fluids or antiviral medications may be administered. The good news is that HMPV is not considered a pandemic threat. It is a known virus and does not spread as easily as some other viruses, such as the flu or COVID-19. This is because it is a known virus and does not spread as easily as some other viruses. However, it can still cause significant illness, especially in vulnerable populations. Therefore, it is still important to take precautions to prevent spreading the virus, especially to vulnerable people. Simple measures like washing hands frequently, wearing masks, and avoiding close contact with infected individuals can make a big difference.